Okay, great. Let's get started, everyone. Thank you for attending our lunchtime webinar series on the third Tuesday of the month. I'm Amy Barnhorst. I'm the director of the Bullet Points Project, and that's California's initiative to develop a curriculum for healthcare providers who are interested in helping reduce the risk of firearm injury and death in their patients. This webinar series is going to take place again on the third Tuesday of the month at noon, and our next one is on July 20th on extreme risk protection orders. All of these webinars are also recorded on our website, bulletpointsproject.org, so you can watch them there later if you like. Today's webinar is on the topic of the epidemiology of firearm injury and death, and it's going to be given by Garen Wintemute, who is an ER physician here at Davis and the director of the Violence Prevention Research Program. And we'll have a chance for Q&A at the end, but I'm going to ask that folks put their Q&A in the chat, or it's not actually labeled the chat section, it's labeled the Q&A section. And I'll go through the questions and kind of curate them, and we'll have time to respond to a lot of them. Before we start, we're going to ask that participants fill out a brief poll. This really helps us inform who's in our audience, what people know, what they're interested in learning, and how we can best develop our materials to help folks in the future. So we'll take one quick minute for that poll. Okay, thanks to all of you who helped give us more information. So a brief introduction to Garen Wintemute. Garen Wintemute is an ER doc here at Davis and one of my previous attendings when I was a resident and a medical student here. He's also the founding director of the Violence Prevention Research Program. He's the Baker Chair in Violence Prevention at UC Davis, and he directs the nation's first publicly funded center for research in firearm violence prevention, the UC Davis Firearm Violence Research Center. He was among the first people to study firearm violence under the lens of a public health problem, and he practices and teaches emergency medicine here and is a full professor at the UC Davis School of Medicine. His current research focuses on violence risk factors and interventions to best prevent violence. I'm going to hand it over to him, and then after we're done, we'll have another brief poll and some question and answer time at the end. So go right ahead, Garen.
Great, thanks. Hi, everybody. Let's get into it. I'm going to move quickly. I actually have a stopwatch running to save lots of time for the Q&A. The decline in motor vehicle death rates over the latter half of the 20th century is widely regarded as one of the greatest public health successes of that period of time, at least in this part of the world. And we got there by implementing a sustained effort to understand the problem and its consequences, to develop prevention initiatives based on that understanding, and to make sure that those initiatives worked. With firearm violence, as I think pretty much everybody knows, we've taken almost the opposite approach. And the upshot is, as you see here, that while motor vehicle injury death, particularly on a per miles driven basis, has declined, the firearm mortality rate was stable for almost 20 years, 15 years at any rate, then started rising and is rising again. We will look at that in the last slide. The contrasts are informative. We're going to do descriptive epidemiology today. This is an image that you're familiar with even if you've never seen it. We are looking at firearm homicide rates by age and by race ethnicity for men in the most recent year for which data are available. This is the image reflecting the truly awful concentration of risk for firearm homicide among young Black men in particular, young men of color more generally. Awful as this picture is, I have to say it represents an improvement. We are nowhere near, however, where we need to be. Contrast homicide with suicide. Same display, death rates for men by age and race ethnicity for 2019. But this time, note that while risk goes up early for all three race ethnicity groups, it really doesn't decline with age, or doesn't decline as pronouncedly. And then, at least for white men, it goes up more rapidly, and then even more rapidly towards the end of the lifespan. Recall that for the nation as a whole, firearm homicide is not quite twice as, firearm suicide is not quite twice as common as firearm homicide. We'll revisit that point in just a minute. Here, I'm combining homicide and suicide. Again, we're looking at rates for men for 2019. So the red line is essentially almost 90% of firearm deaths among African American men are homicide. So the curve we're looking at here is the homicide curve you saw 2 slides ago, plus 10% for suicide. Looks essentially the same. The curve for white non-Hispanic men looks sort of different. Almost 90% of firearm deaths among white non-Hispanic men are suicides. So the blue line here is that suicide curve you saw a moment ago, again plus 10%, but it's made horizontal by the very much higher rate of firearm-related death from violence among young Black men. Now, all the slides I've shown you so far have taken a traditional risk-based approach to the problem. Let's focus on the group at highest risk for all the moral and ethical reasons we might do that. For the pragmatic reason that we might make the biggest impact if, in fact, that risk is changeable, as it has proven to be. But there is a complementary perspective that is called the population health approach to distinguish it from the traditional risk-based public health approach. And I can show you the difference in 2 slides. This risk-based approach looks at death on a per population basis. We are looking at deaths per 100,000 people. The population-based approach looks at burden. It simply asks and answers the question, how much of the problem is there? And to convert from risk to burden, from public to population-based approaches, all we do is take the denominator away and go from deaths per 100,000 people to deaths. So I'm going to do that on the next slide. The next slide shows you the same deaths you're seeing here, but with no denominator. So this is what happens when we take the denominator away. I'm going to toggle back and forth a couple of times. So this is burden. This is risk. This is burden. One of the tenets of the population health approach is the recognition that much or most of the experience of a health problem can be apportioned to people who are individually at low risk for the problem if the low risk population is big enough. And we face something like that here. Note that if we look at burden, beginning in the early 30s, a plurality, and by the mid 40s, a sizable majority of all deaths from firearm violence are among white non-Hispanic men. I make this point not to diminish the truly awful situation that we face for young men of color, young African American men in particular. My point here is that nobody doesn't have skin in this game. And I will say, as somebody who's been working to convert research into policy for almost 40 years, it really matters that everybody thinks they have skin in the game. I'm going to move on. I want to emphasize something here. This, by the way, is my next to last slide. We focus a lot, because we focus on risk, we focus a lot on the teenage years, adolescence for interpersonal violence, the elderly for suicide. We focus on men rather than women because rates for men tend to be 8 to 10 times higher than rates for women. I'm not presenting rates for women today. I'm not talking about IPV today, only because of a lack of time. But I do want to make this point here. Notice among children that very long period of time during which, at the aggregate level, almost nothing happens. we are, I think, really missing an opportunity to intervene and change trajectories before those trajectories are established. And again, in the interest of time, I'm going to leave discussion of that to the discussion. But let me show you a slide that I made yesterday with help from an analyst here, Chris McCord. You know this. One of the well-established points about the epidemiology of firearm violence is that the more firearms there are, on balance, the more firearm violence there is. What you're seeing here is a display of National Instant Criminal Background Check System background checks conducted pursuant to the purchase of a firearm for the last 8 years or so, 7 or 8 years. And over to the right, actually before I say that, the red line is showing you what actually happened. The blue line over to the right is showing you what would have been predicted to happen during 2020 and 2021 based on the experience of the preceding 10 years. And the red line shows you what did happen, and the shaded area shows you the difference. Now, every year, there is a peak just before the end of the year, Christmas. There's another peak in spring, hunting. There's a superimposed peak in election years, see 2016. There are peaks at times of mass shootings. But we are still in the middle. In June of 2021, we are in the middle of something that the nation and world have never seen before, and that is a very sustained increase in firearm purchasing. Let's recap events that we just lived through. January 2020, there's a pandemic on the horizon, and then it's here, and people are nervous. Am I going to need to protect my home? Etc. Shutdown orders are coming. Social unrest, people think might be around the corner. And we start buying guns greatly in excess of the expected number. That tapers off some, but our group actually showed that there was a relationship between the size of the increase in purchasing and the size in the subsequent increase in violence through the spring of last year. And then we got to late spring, early summer. George Floyd is murdered. There are other well-documented, seen by millions of people, courtesy of the internet, instances of police violence with fatal outcomes. There are reactions to those abuses of power. There are reactions to the reactions. Rates of violence take off last summer. Gun purchasing continues in excess. And then we get to the fall. It's an election year, but it's not just any election year. There are efforts to influence the results of the election like we've never seen before. There's concern among gun people that, gee, the gun control guy might win. And then the gun control guy did win. There's the prospect of policy change. There's an organized effort to discredit, overturn the results of the election, leading to what I think is accurately described as an assault on the Capitol, encouraged by the sitting president. And I won't continue to recap. Purchasing has continued. Here's the bottom line. Rates of firearm homicide last year were 25% higher than they were in 2019. It's the first time we've ever seen such an increase. And in 2021, so far, we are seeing yet another such increase, 2021 over 2020. There's been a nearly 50% increase in rates of firearm homicide in many major cities just in the last 2 years. And note, if you go all the way to the right of that image, the increase in purchasing has not slowed down. The increase in rates of violence has not slowed down. This is going to continue. I think we're in for a really awful summer. And the wild card, I was telling Amy just before we went live, I'm writing about this. The wild card is, I think this is probably when this year, maybe next year, when we will start to see for the first time on a large scale, firearm-related political violence. I will stop there and Amy, give you the mic back. I'll leave the screen share up just for a moment so people can see this as we move into Q&A. Thank you all very much.
Thanks, Karen. That was a lot of great info. And we have a bunch of really good questions in the chat, actually, that I'm excited to discuss. Before we do that, we're going to put up another very brief poll, and I want to thank everyone who took the first one. And if you don't mind, click this new link. Don't refresh your old poll. It's just a tiny bit longer, but it's still very brief, and it really helps us get information about these webinars and how we can use it to improve. So quick poll, then Q&A. Okay, great. I'm just going to look at some of the new questions that came in. Excellent. Okay, I'm going to start at the beginning and just, I may summarize some of these and I may consolidate some of them together. So the first one is about whether or not motor vehicles are actually a valid analogy for firearms, because we don't routinely expect teenagers to learn how to shoot effectively. And firearm injuries due to safety features of the hardware are pretty rare. So have improvements in driving safety been found from reductions in operator error?
So no analogy is perfect. The reason I'm smiling is I'm an ER doc. I don't expect teenagers to drive very well either. And the short, kind of overly simplistic answer is we learned the hard way in dealing with motor vehicle trauma that relying on drivers to change their behavior was a failed strategy. I'll give you one example. Seatbelts didn't used to be in cars, so we put them in as an option. Nobody bought them. We required them to be in cars. Nobody wore them except people who were at low risk already. We required people to wear them, and more people did. But the people, I see the analogy to mask wearing, the people who were least likely to wear their seatbelts were people who were at high risk for other reasons. Teenagers, the elderly, and the intoxicated. So we put airbags into cars. We changed the way the roads were built. We changed the way guardrails were designed so they didn't act as spears. We learned that if you rely on changes in user behavior, you will not get where you want to go.
Great, thank you. We have another question about if you can elaborate on the firearm deaths among children, because it seems like the rates of suicide are going up, especially for kids and teens.
That's true for teens. And again, when I say that something is uncommon, I am not intending to de-emphasize how awful it is when it happens. But shootings in the pre-teen age range are uncommon. And there are a lot of years there. I think we have opportunities, some of which are used, but none of which is used adequately, to help change the relationship that young people growing up have, not just to firearms, but to violence as a means of problem solving, that we underutilize. Having said that, I agree that suicide is going up among young people. Actually, we've done some research here on, and plenty of other people have, on so what happened last year with the coronavirus pandemic. I'm actually getting ready to submit today a manuscript that is full of surprises. We asked people about their exposure to violence, and not surprisingly to me, the group, this is a population representative survey in California, the group of people most likely to know somebody who had shot themselves on purpose was old people. I'm old, so I can say that. The group of people most likely to know somebody at risk for harming themselves was respondents ages 18 to 29. I was not ready for that. It might in part reflect the fact that young people have broader social networks, but what it said to me was, I've been ignoring something and so have a lot of other people, and we need to pay attention.
Great, thanks. We got a couple of questions actually about non-fatal injury data and how that has changed over time and if it's changed with the coronavirus pandemic.
How to be brief. The traditional data posted at CDC in the WSCARS website, I'm going to assume I'm talking to people with some technical expertise here, were found to be flawed. A bad sample, too small, bad replacement strategy. We and others have written about it. CDC actually took their estimates down. There are states, California is one of them, where there is not an estimate, but an actual enumeration, and the data are good. CDC is working to get better data back up. And there are other sources that are variably valid. One thing that's used a lot is the Gun Violence Archive. Let me speak to GVA. We've met with their people and have a good sense. For fatalities, you bet. I think most fatalities get reported somewhere. For non-fatals, it's got to make the news in some way for it to be on the Gun Violence Archive. And I'm sorry to remind us that shootings don't necessarily make the news these days. They don't make Facebook reports from agencies, so I'd be a little bit reluctant. We are still working on a good national data set for non-fatal injuries. There's the National Trauma Data Bank, which is trauma centers, but it's only trauma centers. There's the National Emergency Department sample, and HCUP, the abbreviation, the meaning escapes me. Good data, but you got to buy them, and they're not cheap.
Great, thank you. I'm going to try to do as best I can to touch on a lot of these questions. We've gotten a bunch of more really good ones in the chat. A couple of them are about funding. So about the recent commitment from the White House to fund violence intervention efforts, whether that will be research-based or just politically based, and how will that change things going forward?
Boy, color me happy. There were 20 years when there just was no money. And by the way, color me sad, because no money meant no people. And now that money is showing up, we do not have a well-educated, trained labor force to absorb it all. So a lot of effort here is going to recruiting people. That's it. CDC is back in the game. NIH is back in the game. The National Institute of Justice never left. And money is starting to flow in amounts that are nowhere nearly adequate to what we could make use of. I expect that during the current administration, as long as Congress doesn't throw spikes in, we will continue to see money for research. Change the occupant of the White House and it all goes away. One major private sector funder, we and many others are grateful to the National Collaborative for Gun Violence Research, is by design folding, and I don't see a private sector funder ready to step up. The huge amount of funding that was mentioned is going for program, not for primary basic research. Our hope is that a fair amount of the program funding will go to evaluation. And given the dollars being talked about, if 5 to 10% of that money is set aside for evaluation, so that as we did with motor vehicles, we study what we're doing to make sure that it works. That's part of the public health approach. Then I think we have a good start. But I'll end on the sour note, and Amy, be right back to you. I get asked a lot, so how much money is enough? And, well, we need a good labor force, but set that aside. Well, compare this to heart disease, compare this to cancer. Look at dollars spent per death. And what you'll see is that we are 2 orders of magnitude below what's considered adequate for other major health problems.
Okay, great. We also have a question about how we can address political firearm violence before it happens. And since firearm purchasing increases from when there's more social instability, how can we combat that instability?
2 parts to the answer. I am not an optimist about preventing political violence before it happens. I think we're going to need to see it to believe it's possible, most of us. And oh, by the way, the graph that I showed you takes no account of ghost guns, the privately manufactured firearms that exist precisely in order not to be known about. Some savvy guy said, the only gun you really own is the one they don't know about. And ghost guns now account for 30 to 40% of all firearms recovered following a crime in a lot of major law enforcement agencies. This is not a fringe issue. I think, to be honest, we're going to need to step up our efforts to combat domestic terrorism. And by coincidence, I haven't even had a chance to look at it, the administration has issued a new plan today, this morning. So there will be something to look at. But in a piece I wrote late last year, I wrote it in November when nobody thought ghost guns were a problem either. I quoted the head of a senior national security official referring to domestic terrorism, saying, it's as if there's another 2001 out there. We know it's coming. We just don't know what to do about it. That's a paraphrase. We are still in that situation. I think we're going to need to accept the fact that domestic terrorism is not just a possibility, it's right around the corner. Actually, let me give you an example, folks. Don't use this. I'm writing about this week. What's going to happen next year when armed voter suppression, and you know that's coming in places like Texas and elsewhere. What happens when armed voter suppression meets armed voter support? Amy, back to you.
Scary thought. How about, do we have an understanding of the cultural differences as how suicide and or violence are viewed across various ethnic and racial demographics?
I do not. So I can't address the substance. Amy, maybe you can, if that's not breaking the rules. We'll see this. There is lots of variation, and that variation is not sufficiently studied. Amy, if you want to handle the question, take it away.
I know there's a bit of cultural variation in, for suicide. You know, there's some cultures where it is very prohibited, and some religions where it's, you know, very prohibited. That's a protective factor. I don't know much about how violence is viewed. But it's an interesting question. We also have a question that Missouri recently passed a Second Amendment preservation bill which prohibits local law enforcement from enforcing federal gun laws. Will this lead to worsening violence by guns in the state? And since it'll essentially allow federally prohibited persons to access firearms more easily, how can clinicians help ameliorate firearm violence in such states where the laws have such an impact?
Yeah, lots of question in that question. So cue the lawyer that I'm not. So on the one hand, state and local law enforcement authorities are under no obligation to enforce federal statutes. That's a federal obligation. So what's happened here is Missouri's made it mandatory, but they not. I suspect that's going to get tested in the courts. It's a little bit different from passing a law that directly conflicts with federal law. The Supremacy Clause has that territory sort of staked out. I mean, it would have to work its way through the courts. But when there's a conflict between state law and federal law, by practice, federal law wins.
Okay, great. Well, we are at our time. So I want to thank everyone. We had a couple other good questions we didn't have a chance to get to, but thank you all for putting those in the chat and for attending today. And please don't forget that our next webinar, which is going to be on gun violence restraining orders or extreme risk protection laws as they're known, will be also at noon on July 20th. And you can register on the link on our website. These recordings will also be on our website. And we hope to see you next month. Thanks very much. Thank you, Garen.
Thank you, Matt. A pleasure.